Heart is a muscular hollow structure with the size of the fist of a person situated on the left side of the thoracic cavity. It is guarded by ribs and vertebral column. It is conical in shape, broad at anterior end and narrow at the posterior end. It is made up of cardiac muscles which contract and relax rhythmically. Heart is protected by a transparent, thin, double-layered sac called the pericardium. The space between the inner and then the outer layers is called as pericardial space or the pericardial sinus, filled with pericardial fluid. Heart is externally marked by two deep grooves which indicate that heart is internally divided into four chambers. Internal structure of the heart. Heart consists of four chambers. The upper two chambers are called as the auricles, the right and then the left auricles, and the lower two chambers are called as the ventricles, the right and then the left ventricles. The two auricles are separated by interauricular septum and the two ventricles are separated by interventricular septum. The right side of the heart, that is the right auricle and right ventricle, has deoxygenated blood, and the left side of the heart, that is the left auricle and then the left ventricle, has oxygenated blood. The two septums, interauricular and interventricular septum, prevent the mixing of impure and then the pure blood between the right and then the left auricles and ventricles. The auricle and ventricles on both right and left sides are separated by auriculoventricular septum. There are small passages in the right and then the left auriculoventricular septums called as auriculoventricular apertures. For the blood to flow from right auricle to right ventricle and the left auricle to left ventricle, different vessels carry blood to and from the heart. The blood vessels which carry blood to heart are called as veins, and the vessels which carry blood from heart are called as arteries. There are three large veins which carry deoxygenated blood. Superior vena cava vein collects deoxygenated blood from upper parts of the body like the head, neck, arms, hands, and inferior vena cava vein collects deoxygenated blood from lower parts of the body like liver, intestine, legs and kidneys. These two veins open into the right auricle, bring deoxygenated blood to the heart. Pulmonary vein collects oxygenated blood from lungs and opens into the left auricle of the heart. A pair of coronary veins bring deoxygenated blood from the muscles of the heart and open into the right auricle. There are vessels which carry blood from the heart called as the arteries. Heart pumps deoxygenated blood to lungs and oxygenated blood to different parts of the body by means of large arteries called aorta. The systemic aorta arises from the left ventricle and distributes oxygenated blood to different parts of the body. The pulmonary aorta arises from the right ventricle and carries the deoxygenated blood to lungs for purification. A pair of coronary arteries supply pure blood to the muscles of the heart. Do you know what is heart attack? During old age, when the coronary arteries get blocked by cholesterol, then muscle cells in the heart do not receive enough supply of oxygen, or there will be complete arrest of blood supply to the heart. So, the heart cannot work due to lack of blood supply and tends to stop functioning. This is called as heart attack and is fatal if not treated. Blood flows from the heart in one direction only. There are several valves present in the heart which prevent backward flow of blood. The right auriculoventricular septum, which separates right auricle and right ventricle, has a valve which has three valves or cusps called as the tricuspid valve. Impure blood flows from right auricle to right ventricle and This valve prevents backward flow of blood. The left auriculoventricular septum, which separates left auricle and left ventricle, has bicuspid valve or mitral valve, which has two flaps or cusps, which allows pure blood to flow from left auricle to left ventricle. Pulmonary valve, which has three half-moon shaped or semilunar valves, is present at the origin of pulmonary aorta in the right ventricle, allows impure blood to flow from right ventricle to pulmonary aorta and then to lungs. Aortic valve, which has three semilunar valves, is present at the origin of aorta in the left ventricle, allows oxygenated blood to flow from left ventricle to aorta or systemic artery and then to different parts of the body. Heart functions in receiving and pumping the blood. For the heart to pump, it has to contract and relax. Cardiac muscles present in heart muscles help in contraction and relaxation of heart. The contraction of heart is called systole and the relaxation of heart is called diastole. One systole and one diastole are together considered as one heartbeat. The heart contracts and relaxes 70 to 80 times in a minute. Heart as a whole will not contract or relax, that is, both auricles and ventricles do not contract or relax at the same time. Heartbeat is completed in 3 steps. Auricular systole. In this stage, both the auricles contract at the same time and pump blood into the ventricles. Ventricular systole. Both the ventricles contract at the same time and pump blood into the blood vessels. Right ventricle pumps blood into pulmonary artery and left ventricle pumps blood into systemic aorta. The auricles began to relax during this period. Auriculoventricular diastole. Both auricles and ventricles relax and right auricle receives impure blood from vena cava veins and left auricle receives pure blood from pulmonary vein. Double circuit heart. The heart receives blood twice to complete one complete circulation. This is called double circulation and the heart which performs double circulation is called double circuit heart. The two circuits are separate and the two blood streams in the auricles and ventricles are kept separate. The two circuits are pulmonary circulation. In pulmonary circulation, the deoxygenated blood reaches the lungs from right ventricle through pulmonary artery. Here, the blood gets purified, oxygenated, and then the oxygenated blood from lungs is sent to left auricle through pulmonary vein. The oxygenated blood from left auricle is pumped into left ventricle during auricular systole. Pulmonary circulation. Blood from body organs except lungs through superior and inferior vena cava veins enters right auricle, from right auricle to right ventricle to pulmonary trunk to lungs, from lungs to pulmonary vein and from pulmonary vein to left auricle. Systemic circulation. In systemic circulation, the oxygenated blood from left ventricle is pumped into systemic aorta and supplies blood to different organs of the body. The deoxygenated blood from tissues is collected by superior and inferior vena cava, finally sent to auricle. The deoxygenated blood from right auricle is pumped into right ventricle during auricular systole. Blood from lungs is sent to pulmonary vein, from pulmonary vein to left auricle, to left ventricle, to systemic aorta, to arteries, to blood organs, to superior and inferior vena cava, and then finally to right auricle. After having a clear understanding about how blood circulates in the body through blood vessels, let us discuss about blood pressure. Blood pressure. The blood flows into systemic aorta and pulmonary aorta from left and right ventricles with a pressure due to ventricular systole. The pressure with which the blood flows in the blood vessels is called blood pressure. The blood pressure is high in arteries as they receive blood from heart directly. It decreases during its course of circulation and is low in the blood capillaries. The blood pressure is greatly reduced in the veins. Hence, blood pressure is high in arteries and low in veins. Blood pressure is measured by an instrument called sphygmomanometer. The blood pressure is usually written as 120 by 80. The numerator 120 represents the systolic pressure and denominator 80 represents the diastolic pressure. During ventricular systole, the blood is pumped into blood vessels with high pressures. Blood pressure is more. During ventricular diastole, no blood is pumped into blood vessels, so it is lower than systolic blood pressure. Hypertension or hyper blood pressure. The blood pressure temporarily increases during every systole and decreases during every diastole. But in some persons, it is usually higher than 120 by 80 due to deposition of cholesterol on the inner walls of the arteries. The cholesterol deposition leads to narrowing of arterial lumen. Arteries become stiff, lose elasticity and allows less amount of blood. Heart has to pump with great pressure to meet the oxygen requirement. Then the blood pressure is higher than normal. Constant stress and strain, impairment of kidney function, smoking, alcohol consumption are also the reasons for high blood pressure. It usually occurs in persons above 45 years of age. If it is not treated properly, it leads to paralysis or to death. These persons have to check up blood pressure once in every 6 months and have to take controlling measures such as diet control, avoiding smoking and alcohol consumption. Moreover, they have to take appropriate medicines to control this problem.